My name is Lillian Guenther. I'm a pediatric oncologist.
How's your summer been?
It's good.
I see patients with pediatric blood disorders and cancer. I really came to medicine first and foremost as a clinician. But when I was in medical school, I had the opportunity actually to go to the NIH for a year and study pediatric sarcomas, and I just loved it. I was interested in diving deeper into the biology of those tumors that didn't have much in the way of options, especially for patients who have relapsed or metastatic disease. I think a fire was ignited under me with the challenge of trying to help solve some of those puzzles.
My cancer journey began when I was 16 and had really bad pain in my arm. I went to the emergency room and had an X-ray and an MRI. It showed that it was Ewing Sarcoma. I don't think that I actually accepted that I had cancer. I just didn't want to accept that I was sick.
Ewing sarcoma is a bone tumor that affects children and young adults. Maddie's cancer journey has been anything but typical.
There wasn't a lot of options because the type of cancer that I have is extremely rare.
She went through several treatment courses that unfortunately her disease didn't respond well to until she started this trial of immunotherapy.
Lily told me that it was going to be a couple infusions a month and that I would be able to go to school. I didn't lose my hair, I didn't need a port. It was so easy. Until the second week of classes when I just became very sick. I couldn't even walk up my own stairs. I had to drop out of school. I lost 40 pounds. They figured out that it was an autoimmune effect of the immunotherapy I was on.
When I see patients in the clinic, in particular patients who have very difficult to treat cancers, it really inspires me to go back to my laboratory studies to try to understand the genomics of these types of cancers a bit better and really to learn things that will help design new therapies to treat these children.
The physician-scientist path is particularly important because of the ability of these people to translate discoveries from the laboratory into patients. The pipeline of physician scientists has been dwindling, and so we're particularly concerned about making sure that the best physician scientists who do have this training both in the clinic as well as in the laboratory continue to focus their efforts on combating cancer.
With the support from Damon Runyon, I am able to really dive deep into this biology of Ewing sarcoma cells and perform big experiments. I hope that in the next several years, my research will ultimately lead to a clinical trial for patients with this disease that will save lives.
I completely think that the work that Lily's doing could benefit me in the future. At this moment, I am okay, and there's no evidence of disease, but there's always the chance that it's going to come back.
The goal of everything I do in my research is to help patients like Maddie.
It's not fair for any child, for anyone, for any families to have to hear the words, "There's nothing else that we can do." It's just not fair.
If I could come up with a new treatment to add to our options for this disease, that would be the greatest joy of my life.